Question of the week. We had a really interesting one about milk and about goat's milk and about coconut milk. So we asked the one and only Dr. Michael Ross to break down this week's email of the week. And once again, if you have an email or if you have a question that you'd like to send one of our great contributing doctors on the program, just email dr@babytalk360. Joining us is the number one doctor in my books. He always picks up what I call Dr. Michael Ross from Los Angeles. How are you, buddy?
Doing well. It's a little drizzly today here, so I feel like I'm up in Canada, at least with you.
You know, listen, Canada is absolutely gorgeous. It's a bombing right now, minus 30. It's beautiful, but at least I live in a city where we don't have a baseball player who played for the Dodgers and who took female steroids. So
that's true. That's true.
Something you should be very proud of, Dr. Ross. Very proud of that. So we have an email question of the week, and I will read you the question, and you will tell me your thoughts, sir. Question comes in, and it says, a question. My daughter is turning 1 and ready for milk. However, I would prefer to stay away from cow's milk. I've heard great things about goat's milk or coconut milk. What is a healthier alternative? So basically, we're talking milk. And you know what? The one thing that I have to say when I'm going to throw this back to you, Dr. Ross, is that I think we're the only species in the world that drinks other people's milk.
Well, the only other species that drinks cow's milk is cows.
Well, there you go.
So there's 2 of us that are doing that.
Oh.
Now, I just do want to caution the audience that I am an obstetrician or a subspecialist in complicated obstetrics. So any issues regarding your baby's diets, milk intake, please consult your pediatrician with these questions. But there is some interesting information about goat's milk. So firstly, just a reminder, in the first year of life, your child should have formula or breast milk. And we do encourage breastfeeding. We can have a whole session on the advantages of breastfeeding for both you and the baby.
Yeah, we're going to actually have a show upcoming in about a month, but it's called the Breastfeeding Show.
Terrific. So we're gaining a lot of traction with the importance of breastfeeding. There are baby-friendly hospitals throughout the States and Canada that encourage breastfeeding for everyone. That's great. During this first year, we only need breast milk, or if you need to use formula, formula is fine. But as you say in this question, at a year of age, you can start introducing other milks. Now, goat's milk has had some appeal, and some people want to use it for children who are unable to tolerate cow's milk. I wouldn't use it as the primary go-to milk, and I'll explain why as we go through this. But if you are intolerant to cow's milk, or your child is, the goat's milk may be advantageous. And again, the intolerance could be some abdominal pain or colic, as we say, bloating, diarrhea, perhaps some rashes. Now, why might the goat's milk be advantageous for those children who can't tolerate the cow's milk? Well, partly, there may be some less allergenic proteins. And we say allergenic, it's substances in the milk that cause the gastrointestinal tract to react to it. And goat's milk contains a small amount of one of the proteins found in cow's milk, which is called casein. However, both goat's milk and cow's milk each contain other allergenic proteins, one called beta-lactoglobulin, so that if you're allergic or sensitive to cow's milk, you may also have the same reaction to the goat's milk. Now, some people think that the goat's milk has more digestible fat. The fat globules are easier to digest. It has a little less lactose, and there are some children and some adults who are lactose intolerant, and they have bad gastrointestinal symptoms from drinking milk. Now, goat's milk contains a little less. It's sort of a statistically less amount, but probably not clinically less. So for those people who are right on the fringe of being sensitive to cow's milk because of lactose intolerance, goat's milk may be okay. Now, there are some cautions with the goat's milk, and one in particular is that folic acid is in very, very low quantities in the goat's milk as compared to cow's milk. And so you need other foods for your child that is supplemented with folic acid, or you can get goat's milk that is supplemented. You want to avoid goat's milk that's not supplemented with folic acid, but in fact has growth hormones or antibiotics that's been fed to the goats during their breeding. So you have to be very careful when you pick out the goat milk that you're giving to your child. And the most important issue, I feel, is that there are goat's milks that are unpasteurized, just that there are cow's milk. So the only unpasteurized milk that you should be giving to your child is breast milk. Other than that, whether it's cow's milk, which you buy in the store, or goat's milk, be sure that it is pasteurized.
Now, what are some of the, I just want to ask quickly, there's some of the signs that if you're taking, goat's milk or coconut milk and you're trying that out, after a year of age, as you were saying, and it doesn't agree with the child. I mean, are we looking to know right away if there's a rash, that they're going to be sick, diarrhea within the first couple of days of having that new milk, or is this?
Probably within the first couple of days. Again, if you're getting a response, if your child's not doing well and you've introduced food or milk within the last week, you'll be sure to contact your pediatrician. Now, the coconut milk is also interesting. Coconut milk is not truly milk.
Mm-hmm.
It's really a supplement. It's not a dairy product, right? So although we call it a milk, it's not dairy. And it can have some value as a supplement, again, after a year of age, but it should not replace either the cow's milk or formula or breastfeeding or even the goat's milk, because it's nowhere near as nutritionally complete as the cow's milk.
So not a primary.
No, not a primary. Now, it can be used as a supplement. It's tasty if you like it. You can use it for children who have lactose intolerance because it doesn't have a significant amount of lactose. Some people are concerned that coconut, although not truly a nut, some people believe it's a type of nut and can have that nut allergy develop. So again, if you're giving your child coconut milk and you see any bad reaction, rashes, itching, or vomiting, and that need not be immediate, but that could be some days after the first introduction, you need to stop using that food and consult with your pediatrician. Again, certainly if there's any acute allergy and the child's having difficulty breathing or a florid rash, go to the hospital.
Wow. This is the great thing about this show and about these questions, because you never really think you're going to have this many types of answers, and it's the unknown, and there's so many things that could possibly happen one way or another, and that's just milk. So this is the type of thing where I guess you try what you try. Make sure you speak to your local doctor, your local pediatrician, maybe even talk to a nutritionist as well. There's a lot of things to think about with this, but you've shed some light on some things that people actually, not even knowing that coconut milk is not a milk.
Right. And probably not a nut.
And it's not a nut. Unbelievable.
We do have coconuts down in Southern California.
Yes, but we have a lot of nuts over here up in Toronto, Ontario.
All right.
I got to tell you that much, sir. Dr. Michael Ross with the email of the week. Dr. Ross, thank you so much. And remember, you're the only person I trust to bring a live webcam when my daughter is being born, so you can yell at the other obstetrician who's delivering and saying, no, this is how you do it.
I will do that.
I trust you that much, sir.
Okay.
Dr. Michael Ross with the email of the week. And once again, if you have an email question, and specifically if you want to ask Dr. Ross the question, please send it to DR, which is short form for doctor, at babytalk360.com.